Hello, and welcome to this exciting discussion on how we can improve the healthcare experience. We professionals are met with this every day, and so it's a very timely opportunity to have this discussion. Our administrative colleagues have asked us to gather like this, and I've been honored to jump right in with you. Before we do that, I just wanted to give you a little background about myself. My name is Hubbard. I'm a hospitalist. I practice neurology, and I did my training at Nova Southeastern for medical school. I'd gone to Florida A&M University as an undergrad and studied chemistry. After obtaining my degree at Nova, I went on to Hahnemann University where I practiced and studied neurology, and that's where I did my residency. I started at 1998, and TPA, as you're aware, was approved as a treatment for stroke in 1995, just to give you a little bit of context. Okay, I finished neurology training formally 2001, and then I thought maybe I'll start a small private practice in Camden, New Jersey. Now, this was a hospital where it's a tertiary care center and lots of patients coming through there for bypass surgery and invasive cardiac catheterizations and now even neurosurgery. At that time, there was already a neurology group there, and I thought maybe I'll be the second group. Within 1 year or so, that first group left, and then I was there practicing neurology all by myself, and that was a task, but it really stimulated in me that I needed to do a better job. I needed to learn how to communicate, because now all of a sudden there's no second opinion if somebody didn't like what I said or if they didn't like the way I said something. And also I was going to be potentially causing grief and not able to help people get where they wanted to go. So the healthcare experience and patient experience has, from early in my practice and early in my career, been very, very extremely important and even crucial from the standpoint of being in private practice. So let's dig in a little bit more about this patient experience. Now, this is going to be kind of a three-part type of presentation. During the first part of the presentation, we'll define a little bit about what the healthcare experience is, patient experience, and as well healthcare worker experience. We'll define experience a little bit. During the second part, we'll dig in a little more deeply and talk about how we can get there. And then during the last part, we'll talk about the tools of practicing the language of caring, TLC, practicing TLC. So let's jump right in. Now, at this time, who's happy with the healthcare experience? Before, I can tell you, we really did enjoy the autonomy associated with medical practice. We enjoyed developing mastery in what we were doing. Just talking about 15, 20 years ago, I can think back to a couple of patients that would come to me for, let's say, migraines. If they had photosensitivity, I could see to it that they were okay to get their tinted windows tinted. And even patients that had post-concussive encephalopathy or somebody who'd just been playing in a football game, or they were a cheerleader, they had a little concussion, and the question of when they could get back to the game. I was able to manage all of this by myself, and I think pretty effectively. Well, after a while, a lot of bureaucracy kicked in, and these days it's a whole service, a whole service line, a whole program now, and now the government's involved. Now, from the standpoint of a solo physician, you really don't feel like you're developing so much and practicing the art a lot of times that we went into medicine to practice. So we're not happy with the healthcare experience because of this decreasing autonomy. Patients are not happy because of the interpersonal connection that has gone. Nurses aren't happy, and administrators aren't happy either. Other things have changed also. What else has changed, do you think? Well, how about digitization? Apple changed, right? Now, sometimes when we have an interest in developing a new technology or updating our phones, we don't get information that we want, but Apple somehow finds a way to make it okay. So our sense of what service is, our perceptions of what service is, has changed, really. What else has changed? How about Google? There was a time when people would come to us for all the information that was medical, but now access to data has changed. Everybody has access to Google, and it's one of the first things that they do. Maybe they have a difficult time interpreting it, but they have access to data. So their perceptions of where data comes from, who has it, who owns it, what they have to do to get it, this has changed. What else changed? How about copays and deductibles? Copays have gone up, deductibles have increased. Now people are like, okay, I'm paying money. What am I getting for my money? So people have changed regarding their perceptions of value. What else has changed? How about COVID? Now, COVID didn't change everything about this, but gradually people have been developing their own autonomy about what they're going to do with their own bodies and exactly when and exactly how. There was a time way back then that I was looking forward to when patients would become a lot more engaged and a lot more empowered. Well, that day is today, and now that has had implications on the healthcare experience. However, we have yet to respond to it in a way that is perhaps contemporary. And so that's why we're having this discussion today. We've talked about perceptions as being crucial, and really there's no way around it than to understand what patients perceive. It has become crucial that we do what it takes to improve the healthcare experience. In order to do that, one of the first steps is to attune to patient perceptions. There's no way around it, really. Before, we would give people instructions and hope that they took them, hope for the best, and we document that we had these discussions. But now, I don't think it's probably good enough, and we're getting that feedback on our surveys. Now we have to understand what are some of the things that contribute to how patients perceive things. You can probably think of a few yourself. How about their gender? Men and women perceive things differently. That's just the way things are. How about educational level? And how about a patient's philosophy regarding or even their relationship with their church or their religion? All of these things influence how patients perceive what we are saying. And we have to be aware of it. How about their socioeconomic status? And how about their bandwidth? Let's face it, healthcare is not easy. There are a lot of details, a lot of things that have to be done at a certain time and in a certain order for things to turn out well. Bandwidth is extremely important. Information is coming from so many angles, and it's a lot of information. And so bandwidth has a lot to do with how patients perceive information. And what about their friends and people that they hang out with in person, social media? That's who they're talking to first, and that's who they're talking to most. All of these factors have implications on how people perceive information that they're giving them. Now, I love this particular slide because this clinician here, this doctor, is looking at this patient, and at a glance, you might think she's really just paying close attention to what this patient is saying. That's true, but she is also looking deeply to understand what is it that this patient understands, and also how does she feel about what she's saying, and more importantly, why does she feel this way and why does she think this way? This is why she is looking and listening so intensely, and it's something that we have to look into more ourselves, each one of us. We must learn to meet patients where they are. That's basically what we're talking about. It's not probably enough for us to just give information the way we understand it and expect it to be understood. We have to meet patients where they are, and when we're talking about meeting patients where they are, really what we are saying is that we need to be better empathizers. That's where we are. So we need to figure out how it is that we can empathize more with people. Now, many of us feel that we are empathizing, but instead we are sympathizing. Let's talk about the difference. Sympathy is definitely easier. It more requires that we are trying to understand a person from our own perspective and our own experience, our own understanding, and our own knowledge. It doesn't require that we meet the patient where they are. More, it sort of maintains a certain distance. You've probably had a sympathy hug in the past where somebody comes and puts their arm around you and pats you, and it doesn't feel quite warm. It maintains kind of an emotional space, and it also minimizes kind of a vulnerability and the sense that a person is going to feel your pain. When a person is sympathizing, they're probably not somebody who's going to grow and move and transform with you as you grow, move, and transform. And maybe if we're not getting that sympathy that we need when we need it, then we're not able to grow and transform and move. And that is exactly what we need our patients to do. Let's talk about empathy on the other hand. Empathy, when we are giving empathy, it is us that is really listening and really trying to meet that patient, that person, exactly where they are. We're trying to understand what they're saying from their own shoes, from their own experience, from their own perspectives. And when we are that emotionally close, it does increase the likelihood that we are going to feel their pain. We will become more vulnerable. However, the result and the value, the benefits are that there's going to be, and we can set up with this type of approach where we can grow with the patient, that person that we're talking to can grow, and we can move and transform together toward desired health. And so that's why we are talking about empathy today. And that, the more we are able to do that, then we are able to improve the healthcare experience. Now, defining the patient experience just a little more, I have to reference the Barrel Institute, who is a leader. In fact, it's where many physicians and nurses actually become certified. They obtain something called a CXPX. So far, the Barrel Institute has been defining empathy as follows. It's the sum of all interactions shaped by an organization's culture that influence patients' perceptions across the continuum of care. Now, that sounds sterile and it sounds pretty two-dimensional, but let's imagine you close your eyes for a second, maybe 2 or 3 seconds, and then you open your eyes and realize that you're in an ambulance. You get where you're going, the emergency department, and you see some people that are helpful and talking in the background. You're going to be met now by a triage nurse. She's going to come up and start asking you questions. A physician's going to come up. Sooner or later, there are going to be some technicians. They're going to help you get over into the bed. Somebody's going to be checking your blood pressure. Another person is going to be helping you get your shirt off. Another person putting the thermometer in your mouth. And basically what I'm saying is that there's so many interactions that you are having and so many opportunities for you to establish perceptions. Sooner or later, somebody's going to come and whisk you off to get an x-ray, a CAT scan, an EKG, some blood work. All of these are interactions that you're having with multiple people. Now, your family member is calling the hospital, trying to figure out how you're doing, trying to get somebody on the phone. So they're also having an opportunity to have perceptions throughout your brief stay, even within 1 hour. So I hope that this adds some context to this definition. The sum of all interactions shaped by an organization's culture that influence patients' perceptions across the continuum of care. Now, I might add that I've been living with this definition for quite a bit and trying to apply it to my daily work, and I've adjusted it just a bit for my own use. And so for sake of discussion here, because we are defining what is and what is not the patient experience, I've called it the mix of interactions, because I'm not sure if it's a sum. The mix of interactions shaped by an organization's culture that influence patients' perceptions throughout the person's care journey. Now, I'm only drawing that distinction because continuum, it gives me the sense that it's linear, whereas when we go about our health journey, it's not that linear really, and it's kind of 360. And in the scenario that I described, that's happening every day in every emergency department, people are around you 360, and it's not that linear. in my opinion. So just for sake of discussion, let's talk more about the patient experience, and we'll do that this way by comparing it and distinguishing the patient experience from patient satisfaction. Because many times when we hear patient experience, what we're really hearing, what we're thinking sometimes and interchangeably, is patient satisfaction. And they're not really the same, although there's some overlap and there's some relationship. Now, patient satisfaction is subjective, and it's also kind of one-dimensional, if you will. It's probably easier to have this discussion if we talk about something that's not so close to all of us. But with patient satisfaction, what we're talking about is an entity about which there are pre-existing expectations. Let's just take a cup of coffee. You go someplace and you really want a nice cup of coffee. Well, if they pour that cup of coffee and then you go to take a sip and you realize that it's actually kind of lukewarm, it's not hot, you're more likely to be dissatisfied about it because you have this sort of inherent expectation that it's going to be a hot cup of coffee. On the other hand, let's imagine you go to a place and you want to get a hot cup of coffee and it feels very personal. They call you by your name when you show up and you take your credit card out. And then you slide down the counter because that's the way it's done. It's comfortable, they have chairs there. And when your coffee's ready, they call you by your name. Hi, Sean, your coffee's ready. And then you go pick it up. Now that's more of an experience. So you'll recall there was a time when you just go get some coffee and it was really pretty transactional, a transactional relationship. But now it's not just transactional. You go in there, it smells nice, it looks comfortable, people call you by your name in places, there's nice seating there, the lights are just so, the people look very relatable, and so now what we're talking about is a coffee experience rather than coffee. And so this is the kind of transformation and this is the kind of change that we're talking about that other industries are making, but healthcare and education have been lacking. And so that's the reason also why we're having this discussion. So now let's talk more about the patient experience and where we're heading. Anyway, why does it matter, the patient experience? I mean, we want people to do well, right? We want them to be engaged. And also, we know that there's going to be more value had if they're engaged. If we give instructions, also when they have to follow up, there's a certain cost that goes in. We want people to get the value. Speaking of value, this has everything to do with the patient experience. Remember that coffee experience? Now let's imagine that we're talking now about our hospital experience. It's actually more objective. We're talking about experience versus satisfaction. More objective. Did somebody come and explain to me what to do when, ... Okay? Did they do it or did they not do it? It's objective, really. Objective, objective, okay? And it's not one-dimensional at all. We're talking about a 360 degrees opportunity for developing perceptions. People coming from you at all angles. And it's actually 360 degrees opportunities to make improvements, because imagine if everybody is thinking the same way about this patient's experience, and that's the goal. Sometimes we can't control the outcomes, but we can always control the experience, right? Now, the other thing about the experience, if we're distinguishing that from patient satisfaction, is there's a sense of quality and a sense that we're being respected more. Somebody call you by your name and they're referring to you in a very respectful manner. They're calling you not only by your name, but it's the name that you desire to be called by in this particular setting. When you get called by your name that you desire to be called by, you feel respected and you feel a sense of value, and that changes your entire experience. Now, if we get called by, let's say we're 85 years old, and the only people that call us by our first name are other 85-year-olds, then if we get called Bob by somebody who is about the age of our grandchild, then the feeling is disrespect. We can just assume that. So now the other aspect of the patient experience, aside from a sense of quality that's inherent in the feeling of being valued and respected, is that it's easy and simple to use. And then you throw in that there is a personal connection being made. And now what we're talking about is more of an emotional connection. It's more the sense of, this place is where I can grow, I can heal here, I want to come back here. And not only that, I'm going to recommend to others that they come back to this spot. Okay, so that's the difference between the patient satisfaction as well as from patient experience. Okay, now we're speaking more about experience. Okay, I really want you to get a sense of it because it's something that we all enjoy. Each and every one of us gets to make the distinction between satisfaction and experience in our daily journeys and in our daily pleasures. It's what we're choosing. We choose to go to places that serve milkshakes, and then they ask you, do you want whipped cream on them? And then they ask you, do you want a cherry on them? And then afterwards, when you receive it and you say, oh, thank you, and then they reply, it's my pleasure. Does that sound familiar? There are places where you could go like that. And when somebody tells you it's their pleasure, there are some implications there. They're describing their role, they're describing your value, they're describing what gives them happiness, exactly why they exist. They're describing, if you come here, this is what you're going to get. And especially if you hear it all the time in the same places. This simple phrase, does it sound familiar? Chick-fil-A? Of course it does. So this is what we're referring to when we talk about experience versus satisfaction. So if we needed to summarize everything that we've said so far, really what we are saying is we will improve the healthcare experience if we empower patients more. Okay? When we understand what their perceptions are, we're better able to meet them where they are. When we can let them know that we are respecting them by calling them what they want to be called, when we build in value, when it's coming from 360 degrees from everybody involved, what we are very much referencing is a patient's power, their own resources, their own inherent resources to do well. And when we do that, they believe it, they feel it, and they're more likely to want to come back. Okay, so really what we're talking about is empowering patients and letting them know that we care.